Hello and welcome to a recorded lecture on giving patients oral hygiene advice and demonstrating oral hygiene aids. So in this video I'm going to include how we would prepare for an oral hygiene advice session with a patient, including the environment and how we would position ourselves and how we would communicate and interact with the patient, and also looking at specific points of oral hygiene advice, including toothbrushing, the use of fluoride toothpastes, cleaning interdentally, using flossettes and interdental brushes, and also the use of mouthwash. So the first thing that we need to remember when we're giving oral hygiene advice is that as a dental nurse, we can only give advice that is prescribed by the dentist. So we will have a very clear prescription from the dentist that tells us what oral hygiene advice that patient requires, so that we can deliver a very specific oral hygiene session to the patient. When we're looking at conducting an oral hygiene session in a dental practice, we want to make sure that we're based somewhere that is private and allows us to maintain the patient's dignity and provide them with a level of respect that they are entitled to. The dental surgery is the perfect environment for this because obviously it's designed for that type of privacy. However, there are some practices that will have specific areas that are non-clinical so that you can deliver oral hygiene advice to a patient. This might be a separate sort of small room with comfortable seating and a table and sort of a space so that you can have your oral hygiene aids and demonstration models there as well. When you're communicating with a patient, you want to make sure that they know exactly why you are there and also who you are. That's very important. A lot of people forget, especially when we're doing these observations simulated or in a college environment rather than in the dental surgery environment themselves, is to introduce yourself. Let the patient know who you are, what is your role in the dental practice, and why are you there today. So we would always start with introducing ourselves with our name, explaining that we are a student dental nurse and that the dentist has asked us to provide information on whatever the dentist has prescribed in terms of oral hygiene advice. We're going to look at communication in a bit more detail in a future lesson, but what's important to remember is that you use sort of language that isn't jargon. So we don't want to use a lot of dental terms that the patient might not understand. Instead, we want to use a nice, easy, understandable language. So day-to-day terms, or explaining sort of some minimal dental terms that they would need to know. So for example, if we're using the like of interdental brushes, you'll see now that a lot of the supermarkets and packaging will use interdental brushes. So explaining what that is to them so that they can find these products in supermarkets or in their pharmacies and also understand what they mean. Okay, so we're going to start with toothbrushing. So toothbrushing is the most commonly known oral hygiene advice that you're probably going to come up against with a patient, as well as sort of the use of fluoride toothpaste, because this is what we sort of known for a long time. What's important is when you're demonstrating or giving oral hygiene advice, it's actually really helpful to be able to physically show the aids that you're talking about and also how to use them. So things like having a tooth model. So mine's a little bit different because it is the bottom of my anatomy skull that I have. And also having the physical aids with you so that you can demonstrate it clearly. So when we're toothbrushing, we can or we should demonstrate the use of a manual toothbrush and also an electric toothbrush. Obviously, electric toothbrushes are the ones that are recommended most often. You'll see that in advertisement on the TV. You'll probably hear about your dental surgery or your dentist or dental hygienist, hygiene therapist, recommending them to patients. The reason for that is because they work in a slightly different way to obviously how we would use a manual, because the tip here actually creates or carries out an ideal technique for toothbrushing by itself. So it means that the onus is sort of taken away from the patient in terms of perfecting a technique, which really will help improve oral health, and also help engage a patient with improving their oral health as well. So regardless of what toothbrush that we have a patient using, we're not sort of, although we might encourage a patient by letting them know the benefits of using an electric toothbrush, we wouldn't want to pressure a patient into going out and buying an electric toothbrush, because we have to think about the barriers to a patient's changing their oral hygiene routine. And a big one of those barriers can be cost, can be budget, can be income. So we don't want to push the need for a patient to go out and buy a lot of different expensive items, and sort of put up an extra barrier of maybe them not listening to the oral hygiene advice that we're trying to give them based on toothbrushing. So regardless of the toothbrush that we use, we recommend that a patient brushes twice a day. Ideally, we want to recommend to a patient that they brush in the morning and at night, because they are two very clear points in a day that people are going to remember. First thing when you get up, brushing your teeth. Last thing before you go to bed, brushing your teeth. And regardless of when that patient gets up and when that patient goes to bed, there's still two very clear times where they can brush their teeth. Now, when we're brushing our teeth, we recommend at least 2 minutes. And a good way to help a patient get the optimum brushing time is to tell them about splitting their mouth into quadrants. So kind of the way that we look at charting, where we have the upper right, upper left, and lower right on a patient. And if they split their mouth into 4 and split that 2 minutes into 4, it's roughly 30 seconds per area of the mouth, which is a lot easier to sort of count or keep track of as a patient, rather than sort of brushing the whole mouth for 2 minutes, which if you get distracted, you're going to sort of maybe lose count and things like that. Also, obviously for adults and ideally for children as well, you can recommend the use of the little egg timers, the little sand timers, that come along with like child smell packs, or usually on sale in dental practices to help them keep track of time. A lot of toothbrushes now that are aimed at children will have sort of a built-in timer. So whether it's like a musical timer where the music will play for 2 minutes, or my son actually has a little traffic light toothbrush. So if we hit it, green means go, and then as it is being used to brush, the lights will change from green to amber to red. So amber will let him know that it's almost time to finish, and then red is when he can stop. So it'll flash for 2 minutes, and that's a great way of children keeping track of their brushing as well as you, if you're trying to encourage them to get into the swing of brushing their own teeth. So when you're giving toothbrushing advice, you want to make sure that you're letting the patient know that they need to brush all surfaces of all teeth, and we're using small circular motions. Now, you will see some literature, some adverts talk about sort of tilting the toothbrush so it's in towards the gum line, which is really good. And you're just in small circular motions on all surfaces of the tooth, obviously for that 2 minutes or 30 seconds for each quadrant. Okay, and always remember to physically show them, because that is just a good way of you letting them visually see the information that you're talking about, and they might sort of remember visually seeing the demonstration more than they might remember the words that have been sort of spoken. If you have an electric toothbrush in your practice, it's also very good to show them how the technique changes. So because the electric toothbrush does that small circular motion for you, or oscillating. All the patient needs to do is just hold the electric toothbrush on the surface. So you want to sort of avoid them doing the circular motions with an electric toothbrush, because it's already doing that for them. All they need to do is just hold it in place and move it to the next surface when is required. Okay. Now, it's very important to brush our teeth, because it's actually the mechanical motion of these small circular movements that is removing the plaque, that is moving that sort of creamy, sticky film that the patient will see on their teeth. Obviously, part of our key oral health message is to recommend fluoride toothpastes. Now, you may come across a patient that doesn't want or doesn't wish to use a fluoride toothpaste, which is their choice. So you can advise that, although it's not recommended as a key oral health message, because we obviously recommend fluoride as an industry, non-fluoride toothpastes are available on the market and can be used safely, because it is that mechanical process of brushing that is removing that plaque, as opposed to the toothpaste itself. The toothpaste job is there basically to give you like a minty fresh breath, and also if it's a fluoride toothpaste, it's there to strengthen the enamel from acid attacks or lower the risk of decay. So when we're recommending a fluoride toothpaste, we need to recommend that they are using at least 1,450 parts per million. Very recently, it has been increased to 1,500 parts per million, but at least 1,450 parts per million is ideal. You can let the patient know that it should state very clearly if it is a fluoride toothpaste. So we have it here, fluoride toothpaste. And although you probably won't be able to see this, what they should be looking for is in the ingredients list along here, it will state the fluoride and the fluoride amount. So in this one for Oral-B Pro Expert Strong Teeth, it actually separates the two different types of fluoride that it uses. It uses a stannous fluoride, which is 1,100 parts per million, and then a sodium fluoride, which is 350. So that obviously adds up to the 1,450 parts per million that is recommended. Now, it's very important to let the patient know that not all toothpastes on the market will have the recommended amount of fluoride, because it's not mandatory for toothpaste brands to have fluoride in them, and it's not mandatory for brands of fluoride toothpaste to have the recommended amount in it. It is just a recommendation from the dental industry. So children's toothpaste tends to be the most common one where we might not see the recommended amount. This one actually does have it. So this is a Morrison's own brand, Mild Mint. You can see it's for 3+, and it's also recommended by the Oral Health Foundation, or Oral Health Foundation approved. And this actually does have 1,450 parts per million in it, but a lot of children's toothpastes will still have what is the sort of outdated recommended fluoride for children, which was 1,000 parts per million. So it's very important that they have a wee look and get into the habit of looking at the ingredients list in branded toothpaste and non-branded toothpaste, just to make sure that they're receiving the recommended levels. Now, what's very important when we look at toothpaste is, because we have changed the recommended amount for children up to the same as adults, it's about the amount of toothpaste that we use on a brush that is important. So for children up to around the age of 3, we recommend a smear. So you're just taking your toothpaste and just smearing it on, so you can just see that there's a light coating on the toothbrush there. For a child between 3 and around about 6 years old, it is a small pea size. So mine is a bit softer just now because it's been in a warm thing. So this is a bit of a flattened pea. You should be able to see that there's a bit of a lump there. And then with an adult amount, we're using a full pea size. So you can just see the difference there in the amount of toothpaste. So we're not changing the fluoride amount, it's actually the amount of toothpaste that a patient would physically use depending on the age of the patient. Now with children, it's very important for the parent or caregiver to be the one that brushes the patient's teeth or for the child's teeth. The reason for that is because they will be able to reach all of the teeth and all of the surfaces and also be delivering the correct technique. Now, what you will find is a lot of children will want to do it themselves or not want to do it at all. If they want to do it themselves, then you can let the parent or caregiver know that they can encourage that. It's a good thing to allow a child to want to brush their teeth. You just want to make sure that after they are done, the parent then goes in and brushes their teeth, just to make sure that all surfaces are being brushed and all plaque is being removed. And they can do that without any additional toothpaste, because the fluoride in the toothpaste will already be on the teeth there. If a child doesn't want to brush their teeth, what you can do is try and get oral hygiene aids that are going to support that. So for example, like the light up toothbrush or the musical toothbrushes. This one actually has Thomas the Tank Engine on it. So you can get different characters that the child might like, which might encourage them to brush their teeth. So right now we have about 4 toothbrushes in their house. One of them is got an alien on it, and one of them's got Bumblebee from the Transformers, because they are 2 of my son's favourite characters. So that encouraged him to sort of want to buy that toothbrush and to want to use that toothbrush, which is really good. When we are brushing our teeth with a fluoride toothpaste, we want to recommend to the patient that they spit out any excess toothpaste at the end rather than swallowing or rinsing out any toothpaste. The reason that we use a smear with a child is to minimise the amount of excess fluoride toothpaste that is in the child's mouth, and also they're more likely to sort of swallow any sort of like foam or bubbles that's been created by brushing the teeth. And we want to prevent sort of that excess consumption of fluoride if we can. With an adult, they're less likely to do anything like that, so we use the spit, don't rinse recommendation. And the reason for that is because we're using this fluoride toothpaste to strengthen the enamel and used to strengthen the teeth. So once we've brushed on the fluoride onto the teeth, we want to avoid then sort of swishing the mouth with water or with a mouthwash to rinse away that fluoride that's been left on the tooth. We want to leave that there, sort of like a topical ointment, as long as we can, just to let it soak into the enamel structure. So that's a very important thing to remember to tell a patient. With a mouthwash, you might get patients that really like having a mouthwash after they brush their teeth because they sort of like that fresh breath or that fresh mouth feeling. And you just want to make it very clear to them why we don't recommend rinsing with a mouthwash straight after brushing the teeth. Even if we have mouthwashes that are fluoridated or have fluoride in them. So this one, for example, talks about 24/7 plaque protection. It effectively fights bacteria, because it does have a level of fluoride in it. This one has sodium fluoride in it and actually doesn't say how much fluoride is in it, but we can assume very confidently that it doesn't have as much fluoride as our fluoride toothpastes. So we're basically, if we were rinsing with this, although there is some fluoride there, it wouldn't be as beneficial as it would be to leave the fluoride toothpaste residue in the mouth. What we want to recommend to a patient with a mouthwash is that instead of using it directly after brushing, that they use it as a separate time from brushing. So a really good time to recommend is like after every meal, because again, similar to the morning and night, it's a very clear time when a patient can use a mouthwash. So regardless of when their breakfast, lunch, dinner happens to be, it's a very clear, I've had something to eat, I've had a meal, I can use my mouthwash now. And they just want to swish it around their mouth and discard it rather than swallowing it again. Another important thing to remember when recommending mouthwashes is to ensure that they use one that's alcohol free. So you can see here this one says 0 alcohol on it. And also that it doesn't contain any sugars. So some mouthwashes on the market do have sugar in them, especially if they are like a sort of a synthetic flavour, so ones that are like strawberry flavoured or something like that. And also that some of them do have an alcohol content. Now, the reason that we avoid ones with an alcohol content is because alcohol consumption can be a risk factor, for oral cancers. So we want to minimise that. And also, sugars is obviously that risk factor for dental caries. So again, we want to minimise the risk for that for patients. So a really important part of our oral hygiene routine now is cleaning interdentally. So our toothbrushes and our fluoride toothpaste take care of sort of like the big surface that we see in the teeth. However, toothbrushes can't really get into the interdental spaces as effectively as they need to. So that's why we have interdental hygiene aids that we now recommend. So most common one that we'll know of is floss. We do get dental tape now, and we also get flossettes, which is little floss harps that have a little bit of floss sort of attached to them. And these ones also have a little toothpick as well that you can use. And also sort of more newly to the market and more modern is our interdental space brushes and our interdental brushes. Our interdental space cleaners or interdental space brushes are just little rubber versions of our interdental brushes. You can see there. And then obviously a big brand that we know is TP, interdental brush. And then these are supermarket owned. So these are Morrison's own brand interdental brushes that we have. Okay. So it is important to clean interdentally. So interdentally is the space in between our teeth. And it's important to advise the patient of that because, as I said, they'll have heard of interdental before or interdental cleaning and flossing, but they might not actually know what interdental is. So we want to recommend that they clean in between their teeth as well as brushing their teeth. We recommend that we do that at least once a day. Some patients will do it more, but at least once a day is a good habit to include in your oral hygiene routine. So we'll start with floss because that's probably the most well known. When you're using floss, it's recommended that we use about a 4 arms length. So that's, I'm just going to stay back, about that. You don't really need any more than that. That should be sufficient. The reason that we use a big length like this is because we wrap it around our index finger and we use our index finger and our thumb, so you can see that here, to move and manipulate the floss. If we only had a small part, we wouldn't be able to wrap it around our index finger as much. And also, when we start to clean a different interdental space, it means that we can move along the floss and use a clean bit of floss. And we have quite a lot of clean floss there to use in a length like your forearm. So as I said, we wrap the floss around our index fingers and hold on to it with our index fingers and our thumb because that allows us to move it around. Now with floss, it's very important you put it in between your teeth and we do a C motion. It's known as a C technique. Technically, when we're sort of looking at it, it's kind of like a small N or a U because we're obviously going up and around and down. But it's basically the shape of it. Now, I'll try to do this in a way that you can see. But we're basically doing a big swoop like this, like a C. All right, so it's not just an in and a sort of a sawing action and back. It's a big curly C motion. So a big curly C motion like this, kind of like you're rowing a boat or rowing a canoe. So as I said before, it's quite good to have your dental model in front of you because again they get to see what you're physically talking about. So this one's a bit tricky because it doesn't sort of go down very easy, but you go down one side of one tooth, you scoop it round and you bring it back up the other side of the tooth. So you're essentially going down like this, down one side, scooping back and back up. Okay, obviously if it was an upper, you'd be going up, scooping and then down again. Alright? So that's very important when we do the C motion. Now, as I said, once you've done one, side and skip round and back down, and you move on to the next bit of the next tooth. Move your fingers along so you have a nice fresh bit of floss, and then up, round and down again. Okay. Now, the main reason that people will not floss or not clean interdentally is because they will start to see blood. A lot of people will assume that is because the floss is in some way damaging the gingiva and the gum. And that's actually not the case. Bleeding is a sign of inflammation. It's one of the cardinal signs of inflammation. So when the body has infection, what it does is it wants to flood that area with blood. It's just that we've sort of agitated it slightly and we've allowed the gum to bleed because it's already inflamed. A healthy gum wouldn't bleed even with a probing or a touching or being flossed. So bleeding is actually quite a good sign for us when we start to sort of include this in our oral hygiene routine, because it shows us that we're getting to the areas that are inflamed, and eventually, if this habit is continued, we will start to see a decrease in the bleeding to the point where there will be no bleeding, because we have treated or improved the gingivitis in that area. So as you can see from that, sometimes it's a bit fiddly. Some people might not have the dexterity in their hands, so it might be difficult for them to do that motion. They might have things like arthritis that can sort of make that motion quite difficult. So that's why a flossette or a floss harp or dental harp, depending where you buy them from, is quite good, because what we can do with this is we're still using the same motion. It's just that we just need to do it with one hand. So we're bringing it down one side, scooping it up and bringing it back out the other. Interdental brushes and interdental spacers are slightly different because we use a slightly different technique. So although they're still there to remove plaque in between the teeth, we do it in a different motion. We don't use the C technique. Now, an important thing to let a patient know when we're looking at interdental brushes, especially if they're buying different brands that you are, from what you're sort of demonstrating. So a lot of dental practices will have TP brushes, but it is okay. It's as equally as recommended for a patient to be using a supermarket's own brand or a shop's own brand or non-branded interdental brush. TP brushes, you may or may not be able to see that. May or may not be able to see that. But along sort of here, just at the top of this sticker, there is a little size guide. So the TP brushes are colour coded depending on the size that they are. So for example, these are 0.6 millimeters in size and they are a light blue. Now TP is a brand and therefore that branding colour is specific to that brand. So in a supermarket zone, they might not be the same colour at all, or they might be slightly different. So for example, the Morrison's ones, these are the same size as the TP, but you can see there that this is a darker blue. Okay, now TP do have a darker blue size, so they might not, a patient might see these and go, oh, that can't be right because they're not a light blue like the TP. So it's very important to let them know that when they are recommended a size by the dentist, that they must go with the actual sizing as opposed to the colour. Because if they buy one that's not branded by TP, then the colour is going to be different. So for example, the Asda's own brand might have 0.6 millimeters as a pink colour or an orange colour. Or if they go to Poundland, they might just all be white and just have the sizes. So it's important that they know the size as well. Now, if a patient asks you what size interdental brush they should use, then you must refer that to the dentist, because that's not a decision that a dental nurse or a student dental nurse would be making. So we must refer that to the clinician that has prescribed it, so the dentist or the hygienist or hygiene therapist, depending on where the prescription has come from. And they'll be able to let them know what size interdental brush that they use, because for example with this here, you can see that there are sort of different sized gaps in the teeth. So it might be that they need a range of sizes to accommodate the whole mouth. So I actually have a gap down here because I've lost them, or didn't lose, I never had my lower fours go in. So for example, that space would require a different size TP brush to my sort of upper anteriors. So that's important to note as well. So when we are given advice on interdental brushes, we're not given advice on size. We would always refer that to the dentist or the clinician. But instead, what we're doing is showing how they work. So as I said, it's slightly different a technique because we don't need to use the C motion. Instead, what we're doing is we are putting the brush into the space, twisting it round and bringing it back out. Very simple. Again, if there's bleeding, try to encourage the patient not to get disheartened by this or get put off by this. It's just shown that there is inflammation there and that there's a need to clean interdentally. So again, just in, twist, and then back out. Now, unlike floss, which we can sort of use one length and then once it's been used, we would discard this into a bin. Interdental brushes and interspace brushes can be used multiple times. What we want to check for is once the little bristles start to get splayed, we would discard of that and we would use another one from our pack. And it's quite handy because they will come in packs of around about like 6 or 7 brushes. So they can be cost effective. So they can just rinse these and use these again. And then once it starts to get splayed and sort of lose its bristles, then obviously it's not doing its job anymore. And we would discard all of it and we would replace it with another one from the pack. Now, some patients can use or would like to use a fluoride gel with interdental brushes, which is becoming more common in the market. So it's kind of like a toothpaste for an interdental brush. And all you're doing is just putting a little smear on it and just putting it in, twisting and taking it back out. And it's just another way of getting some fluoride into those interdental spaces. Similarly to our interdental brushes, it's important to note to a patient that their toothbrush should probably last about 3 months. Once it starts to get splayed, so sort of pushing out or losing bristles, then we should start to think about replacing that toothbrush so that we're using it effectively. Electric toothbrushes will be the same. They will splay and you can sort of pop these off and get replacements as well. So it's important to let the patient know about how to maintain or when to change and replace the oral hygiene aids that they are using. Okay. Thank you very much for watching. I hope that's been helpful for you. See you again soon. Bye.